Now we'll do the unilateral AS and unilateral PS. Okay? So let's say that the legs are balanced. We bring them into flexion and they remain balanced. He rotates his face right. Okay? And let's say the right leg draws short, back in the center. He rotates his face left and nothing happens. Okay? Back in the center. Okay? So now we know the problem is on the right side. Okay? And when he turns his face right, the right leg draws short. So that means that we have AS, a fixation just on that side. Okay? So Jason, turn your face this way. We'll set the thoracic and cervical section of the table to drop. You could use either hand to make contact. We're making contact right on the anterior part of the mastoid process. Okay? Roll in Pisciform, sort of knife edge, get the ear out of the way. The table is set to drop, and it's like a sustained toggle with the drop. Okay? It's not like the toggle record, just stay with it and sustain toggle. Okay? Back in the center.
What was that contact?
The anterior part of the mastoid. We'll do the post check. The legs are still balanced. We will bring them into flexion and they stay balanced. He rotates his face right. They stay balanced, back in the center. He rotates his face left and they stay balanced, back in the center. Okay. Unilateral AS occiput. Unilateral PS occiput. Legs are balanced. We will bring them into flexion and they stay balanced. Let's say that he turns his face right, and when he turns his face right, the left draws short. Back in the center, turns his face left, and nothing happens, back in the center. So in this case, what we have is a PS occiput on the left side. Okay, because when he turns his face right, the left leg drew short. So that means that the left lateral mass, condyle on the lateral mass is not moving toward the anterior. So we'll rotate your face that way for me. This time, we'll stand behind the patient. The head's rotated away. You can use either hand, and we're making contact on the posterior mastoid this time. So we'll find it. Set the table to release, and like the other one, you could use either hand. That's your nail hand, and it also is a sustained toggle. Okay, correcting from posterior to anterior. PS occiput back in center. At this point, the legs are still balanced. We will bring them into flexion, and they remain balanced. He rotates his face right, and they stay balanced, back in the center. He rotates his face left, they stay balanced, back in the center, and just close palpate there. Okay. So we've done four listings today: bilateral, contralateral, or hidden deer field. And hidden deer field also could be occiput. Okay. And unilateral AS, unilateral PS. Any questions about those? Everyone's okay with that?